people who some folks are still going to be joining us as we start, but there's so much good stuff coming that I think we should go ahead and get started. Good afternoon, everyone, or good morning if you're in a different time zone. Thank you for joining us today. I am Ronnie Snyder. I'm the president of the John A. Hartford Foundation. For visual descriptions, I am a white woman with, I don't know, dark blonde or light brown hair, shoulder length, with blue eyes and glasses, and I'm wearing a red jacket today. So I'll talk a little bit about our foundation. We're a national, nonpartisan, private philanthropy that's based in New York City, and we have a mission to improve the care of older people. We do that by building age-friendly health systems, supporting family caregivers, as well as other caregivers, and improving serious illness end-of-life care. And I want to note that we joined the Care Fund at the end of 2025 because we very truly saw the importance of joining together with other funders to advance support for family caregiving across the lifespan. And we and many of you know the reality of sandwich caregiving, raising children while also caring for an older relative. A lot of spousal caregivers are themselves older adults. And so we understand that people supporting adult children living with disabilities are also aging, and disabled people are aging too. So this is, a very large cohort of folks. And as one of the few national foundations that is focused exclusively on aging and also disability and health, we saw an opportunity with the Care Fund to elevate aging issues within the broader and really important care movement. So we invite funders and others who focus on care from a variety of different angles to consider joining us as part of the Care Fund. I often say when I'm speaking publicly that coordination, collaboration is amplification. And together, as funders and as funded organizations, we have the opportunity to continue building the momentum that has been underway to better support all kinds of caregivers who are often the glue that are holding together our very fragmented healthcare and long-term care systems. So I am delighted to welcome you to today's conversations, Care and Work, Improving the Livelihoods of Family Caregivers and Care Workers. In our foundation, we know that family caregivers and care workers are both essential to older people. They are deeply connected. And when family caregivers don't have the support that they need, their health and their finances are both likely to suffer. When paid caregivers don't have quality jobs, families and older adults feel those consequences also. So today's conversation is going to help us look at both sides of the care equation, the policies and workplace changes that family caregivers need, and the changes needed to improve the quality of paid care jobs at the same time. Our speakers, you're in for a great panel. They're going to point to various concrete strategies to better recognize the relationship between family caregivers and direct care workers, which we at our foundation fully believe needs to be a part of the national strategy to support family caregivers, which is a congressionally mandated blueprint released in 2022 by the Administration for Community Living, which continues to guide government and private sector and funder actions in support of caregivers. So thank you to today's moderator, Ana Wadia, and to each of our fantastic panelists for sharing all of your expertise and your leadership. And thank you to everyone who's here in the audience for being here, for your commitment to building a stronger and more equitable care system. We think you might want to join us in the Care Fund itself to continue that work. So with that, I'm going to turn it over to Ana to begin this wonderful conversation.
Thank you so much, Ronnie. We are so grateful for the John A. Hartford's partnership, both as a partner in the Care Fund and also just as a thought partner in this field and in this work. So thank you so much. My name, as Ronnie said, is Ana Wadia. I'm the Executive Director of the Care for All with Respect and Equity Fund, or the Care Fund. Reflecting our commitment to inclusion, I'll share that I am a woman with light brown skin and shoulder length brown and gray hair. And as a proud New Yorker today, I am wearing an orange and blue dress and a blue shirt. blue sweater. The Care Fund, as Ronnie said, is a unique collaborative that brings funders together across their differences to build the power of the care movement. And that spirit of collaboration is reflected in the theme of today's webinar on care and work. We believe that we all need to come together to demand equitable solutions to our care crisis. Whether we're trying to care for loved ones while holding down a job, or whether care is our job. Today, we're going to focus on the family caregivers and paid care workers caring for older adults and people with disabilities or serious medical conditions. You're going to hear some striking statistics on the number of such family caregivers and the proportion who work. The Care Fund also focuses on parents of young children and childcare providers. And when you add them to the figures you'll hear from your presenters, it doubles the number of caregivers and really shows that this is an imperative for the majority of people in this country. I'm thrilled that several Care Fund grantees will be sharing their insights today on the supports needed by family caregivers in the workforce, as well as strategies to improve the quality of paid care jobs. First, Jason Resendez, the president and CEO of the National Alliance for Caregiving, will present data from the in-depth Caregiving in the U.S. survey that his organization conducts every 5 years with AARP. We will then bring in Inamai Chettiar, president of A Better Balance, and Hayoung Yoon, vice president for policy and advocacy at the National Domestic Workers Alliance, to share and join the discussion around challenges and policy solutions. And then we'll have about 10 minutes at the end for your questions. So please feel free to put questions in the Q&A box as they come to you. If you want to share links and other resources with people on the call, feel free to put that in the chat, but please put your questions in the Q&A. So we're going to start by testing your knowledge with a quick poll. Whitney, can you launch the poll, please? There we go. So in 2015, there were 43 million family caregivers caring for someone with a chronic condition, a serious illness, or a disability. Today, we want you to come up with your best guess of how many such family caregivers there are today. Is it 30 million, 63 million, or 71 million? We'll give you a couple seconds to answer the poll. All right. Whitney, can you please see how people responded? All right. So I am going to turn it over to Jason for the big reveal to see what the correct answer to this question is, and also to dig into what you have learned from caregiving in the US about family caregivers in general, and especially about those who are also in the paid workforce. Take it away, Jason.
Excellent. Thanks so much, Anna. Can everyone see my screen? Thumbs up. Great. And I'm Jason, light-skinned Mexican-American wearing a white button-up shirt and paisley tie and very enthusiastic face for this conversation today. And really impressed by the responses. I think says that the National Alliance for Caregiving and AARP are doing something right, that the majority of folks got that answer correct. And I'll share many insights from our landmark Caregiving in the US data project in partnership with AARP today. But the first is that caregiving isn't a single life stage. As this graphic represents, it cuts across the entire lifespan, from young adults caring for a parent to people raising children while supporting aging family members to a husband caring for a wife living with cancer. Whoever you are, caregiving will likely touch your life in one form or another. And as the poll represents, it is growing fast. In 2015, there were about 43 million family caregivers. By 2020, there were 53 million family caregivers, and today that number has reached 63 million. And we see that as the floor, not the ceiling, on the number of family caregivers engaged in ongoing, demanding care for a loved one with a serious illness or disability. That's a nearly 50% increase in just 10 years. This isn't just a trend, it's a structural shift in how Americans live and work. Put another way, nearly 1 in 4 Americans is now a family caregiver. This spans every community and every zip code. It's happening in your workplace and in your neighborhoods, in your congregations, in everywhere you go. So, who are these family caregivers? The average family caregiver is a 51-year-old, but 2 in 5 are under the age of 50. This is an increasingly younger working age population. They're majority women, but a significant share are men. Nearly 40% are people of color, with women of color shouldering a disproportionate share of our nation's caregiving responsibilities. 1 in 5 live with a disability themselves, and 1 in 10 identify as LGBTQ+. So caregiving spans not just every community, but every identity in American life. And many are caring in more than one direction. 16 million Americans are in this sandwich generation, supporting aging parents and raising children at the same time, stretched across the entire continuum of care. And this reality underscores the importance of many of the policies that we'll talk about today and that the Care Fund champions, from child care policy to paid family and medical leave and Medicaid home and community-based services. Without these policies, caregiving takes a real toll, compromising the physical, emotional, and financial health of American families across the country. Nearly 2/3 of caregivers face moderate to high emotional stress. Almost half experience physical strain, and 1 in 4 report feeling alone. And that's risen since 2020. Caregiving can be isolating in a way that we don't talk about enough in American society and culture. And the financial impact is just as extensive. Nearly half of family caregivers take a financial hit. Almost a third have stopped saving, and most alarming, 14%, that's 9 million family caregivers, can't afford basic expenses like food because of the cost of caregiving and caregiving responsibilities. And this is where care and work collide. 6 in 10 family caregivers are working while providing care, and that number jumps to 70% for working age adults. Most are juggling, going in late, leaving early, taking time off, and many are hourly workers without access to benefits, which forces them into debt and worse financial outcomes. Work and care aren't separate problems, they're part of the same issue, and we have to address it through that lens. And caregivers are also filling real gaps in our care workforce. 11 million family caregivers, according to our research, receive some form of payment for the care services they provide in their communities through programs like Medicaid-funded self-direction. Self-direction programs are critical to helping us address our national direct care workforce crisis and to giving families choices for accessing quality care in their home and communities. This is also one of the programs that is increasingly under threat with cuts to Medicaid-funded home and community-based services. And I know we'll talk a little bit more about that later. And here's a number that should reframe the whole conversation. The value of family care in 2025 is estimated to be over $1 trillion, according to our friends at AARP, and based off the very research I'm sharing with you today. To put that in perspective, that's more than all Medicaid spending and more than all out-of-pocket health spending in this country. To me, this number makes a simple truth crystal clear. Family caregivers invest more in us than we invest in them, and that's an issue that we have to address collectively. So what do caregivers actually want? They're telling us clearly in our research they want respite, time to recharge. It's the single most requested form of support that we see. Two in three want payment programs like self-directed care and tax credits. And half want paid leave to balance care and work responsibilities. These aren't abstract ideas. They're what caregivers are asking for directly, and they're all tested policies that work at the state level in other countries that we need to export at scale in the US. And the good news is that we are seeing progress. We're seeing new Medicare codes that now reimburse family caregiver or providers for training and identifying family caregivers. 14 states and DC have paid family and medical leave policies. Around 10 states offer caregiver tax credits, including red states like Nebraska and Oklahoma. And Washington State launched the first public long-term care benefit funded by a payroll tax, important policy that's been protected twice at the ballot box. So momentum is real, and when care is on the ballot, it wins. And I want to end sharing not just the hardships that so many caregivers face, because amidst the challenges and the emotional distress, more than half of family caregivers report a deep sense of purpose and meaning in their care work. So, care is hard, there's no doubt about it, but it's also deeply meaningful and purposeful. And it's that purpose that we have to prioritize and elevate by addressing the policy challenges that get in the way of the joy that comes from care. This is a link to our Caregiving in the US resources, our national data interactive dashboard, and also our state companion report where we break down this data at the state level across the country. It's been absolutely critical right now as states scramble to protect many of the policy gains that we'll talk about today. And I'd be remiss if I didn't highlight the generous supporters who made this research possible. I'm excited to be part of the conversation. And I think our call to action is clear that caregiving touches all of us. It's growing. The caregivers are telling us exactly what they need, and it's up to us to listen to them and act alongside them to create a more caring future. Thanks, and back over to you, Anna.
Thank you so much, Jason, for giving us that overview of this really groundbreaking research that UNARP have conducted. So now we want to start digging into it and say, like, what can we do to actually make the lives of family caregivers better, as well as the care workforce? So, Inema, I'm going to turn to you first. Your organization, A Better Balance, has long championed public policies that support caregivers in the workplace. Can you share what policies are most needed and where we've seen progress?
Yes, thank you, Anna. So I'm Inima Chettiar. My pronouns are she, her. In terms of visuals, I'm a dark brown Indian woman with wavy black hair, wearing a black sweater and glasses, and I'm joining from Hoboken, New Jersey. So, as Jason laid out, caregiving might feel personal, but its consequences are really societal and systemic and really span very widely across the country. And that's why solutions really need to happen at the policy level. One of the main solutions that we have been championing here at A Better Balance is paid leave. So we think no one should need to choose between a paycheck and caring for someone they love. The United States is still one of the few countries without a national paid leave program, which has left states to fill in that gap with a wide patchwork of policies. So there are two policies that are especially important. So the first is paid family and medical leave, and the second is paid sick time. So, paid family medical leave covers longer term needs. So, such as someone who's recovering from surgery, someone who's caring for a seriously ill loved one, or welcoming a new child. And paid sick time helps workers manage shorter term needs, such as taking someone to a medical appointment or staying home during an illness. But having these laws on paper isn't enough. The policies really need to actually work for workers. So that means policies that not only provide this paid leave, but also have inclusive definitions of family. So that go far beyond so-called traditional definitions of family. Laws that have strong wage replacement so that workers can actually afford to take leave, and also job protection so that people can return to work without fear of losing their jobs. This also means recognizing that paid leave is more than just parental leave. So, more and more Americans are caring for aging parents, family members with disabilities, and loved ones at the end of life, which I think really shone through in the data that Jason presented. So we are seeing real momentum on paid leave. And one example, this year in Virginia, Virginia became the first Southern state to pass both comprehensive paid family medical leave and paid sick leave. And this was a huge win for our coalition, something that had been 8+ years in the making. But it's also a really important political lesson. So in this case, the governor campaigned on it, made it something that was central to her campaign, and it really showed that candidates should not shy away from talking about care and instead should be lifting it up and really campaigning on it. Caregiving is universal and every family experiences it. And increasingly, caregiving is also tied to affordability. So we are in the middle of an exploding affordability crisis. And when someone has to cut back their hours or leave work to provide care, it can quickly become a household economic crisis. So, in addition to states like Virginia, we are also seeing incremental progress across the South. And each of these state level wins, even if they may look small, they actually not only help workers who are able to be helped by those laws, but also builds the case for broader change. So in 2021, Georgia became the first Southern state to provide paid parental leave to government employees. And in just the few years since then, Georgia's also expanded um, that policy twice to extend the length of leave. And this year, we saw Mississippi extend its paid leave for government employees who are primary caregivers, that they can now take 6 weeks of paid leave after birth or adoption of a child. And this year, we also saw Tennessee pass a bill to expand its parental leave for government workers to include new foster parents as well. So we are seeing all of these steps happen, especially across the South, which is very interesting. And finally, I would just name that we also need stronger protections against caregiver discrimination. So, too often, workers with caregiving responsibilities are viewed as less committed or passed over for opportunities, denied flexibility, or penalized for taking time to care for family. Yet we know that 1 in 4 adults in the US is a caregiver, and so that there are so many people who are trying to balance that responsibility alongside work. So some states and localities have begun to prohibit discrimination based on caregiving responsibilities. So, for example, the state of New York protects parents against discrimination, while New York City protects parents as well as other caregivers. So, for example, under these laws, an employee could not be fired for requesting an adjusted schedule for caregiving duties if adjusted schedules were also being provided for other employees for other reasons. So, I will just wrap with that. Those are the two main things that we've been looking at a better balance in terms of really trying to address the caregiving crisis.
Thank you so much, NMI. And you'll have a chance to talk about some other solutions as we move through the discussion. So now I'd like to turn to Hayoung. The home care workforce is one of the fastest growing job sectors in this country, yet the workers are among the worst paid in our economy. And they struggle to care for their own families, ironically. So can you tell us more about the care workforce, the particular challenges that they are facing right now, especially as a disproportionately immigrant workforce, and what NDWA and other organizations are doing to protect and expand their rights.
Thank you, Anna. And it's really amazing to be part of this conversation. Again, I'm Hye Young Yoon. I'm with the National Domestic Workers Alliance. And just for visuals, I'm a East Asian woman with dark shoulder length hair, and I'm wearing a light blue shirt. I want to ground your question, Anna, with some of the stories of what our members are experiencing, and what we're seeing out in the world. So as you talked about, I think, and Jason talked about this, like as family caregivers are earning low wages, home care workers, as one of the fastest growing occupation, are also earning very, very low wages. On average, home care workers earning $16 an hour. On an annual median wage is about $26,000. We all know that $26,000 is not a sustaining income to support themselves and their family members, right? And that I think, especially in this moment, the immigrant workers and who make up a third of direct care workforce in this country are having, I don't need to say how challenging it is. And so I want to just ground with a couple of stories. The impact of this administration's aggressive set of aggressive and chaotic policies and action is making each care job a story of a set of lives upended. So take Mike, for example, a care worker from California who provides care to a retired U.S. Marine veteran with dementia who needs round-the-clock care. And Mike and his client, both with no relatives of their own in California, are now like family. Mike provides consistent support, but he's also waiting for the outcome of his asylum case. And if he loses, they will both lose it all. I also want to ground this conversation with an article that ran in local newspaper in Boca Raton, Florida, earlier this year. It was of senior residential care, and about 500 seniors are living in this facility, and 1 out of 10 of their employees are of Haitian background. And when this administration announced that they were going to arbitrarily terminate temporary protected status program, which is a program that allows people who cannot return home because due to natural disaster or political conditions are here and working and living with work permits. So, and significant portion of Haitian immigrants are working in direct care sector. So when this news became live that this administration was arbitrarily terminating the Haiti TPS program, many of the residents at the senior facility in Boca Raton began to talk about how they want to hide their Haitian employees in their apartments because they didn't want their employees to be deported to a very dangerous situation. I think these stories really ground what paid care workers do. And immigrant workers, along with other workers, care workers, play a foundation role in caregiving and really making providing that critical services. And so I just wanted to ground it there. And I don't need to belay the point of how hard it is for immigrant workers, but I also want to say last year, this administration started a rulemaking process to strip home care workers, over 2 million home care workers, from their right to federal minimum wage and overtime protection. So I just want to ground the conversation of what the federal minimum wage rate is in this country. It's $7.25. Right? So in 2013, under the Obama administration, over 2 million home care workers finally won their right to federal minimum wage and overtime protections. And they've been enjoying this right and protection for over a decade. And this administration came in and said, this workforce that is one of the fastest growing occupation in our country, who provide these critical support and services, because they're one of the fastest growing occupation in our economy, they will play an outsized role in our economy. And the administration is saying is that their labor is not even worthy of $7.25 an hour. So that's the context in which the workers are providing the critical services and care. What are we doing? I think in this moment, we're very much in terms of minimizing and addressing the crisis that people are facing. So as the National Guard and ICE, the immigration enforcement moved from LA to DC to Chicago to Minnesota and everywhere across the country, we are trying to provide support to our workers because too many of them, including both documented US born workers as well as immigrants, are too afraid to go home because of this violence that is taking place in our streets across the country, right? So we're doing that. At the same time, we are also looking ahead to we're really building out a future forward-looking agenda, right? I think everyone on this call agrees that we need to really build out the most robust care system, right? And that isn't just about raising workers' wages. It is really about putting an meaningful investment to this system so that everyone who needs care could access it and that care is affordable, right? And the workers who provide that care are earning family sustaining wages so they themselves can support themselves and the care they need to provide, right? So while we're very much in the defensive fight, we're also looking ahead. I would also say that because immigrant workers play such a foundational role in caregiving, and a third of direct care workers are immigrant workers, we also very much see changing immigration policy to provide a secure path for them to work in this country with dignity and protection is an important part of addressing the care crisis and building the most robust care system. So we have a proposal called Care for America, which is creating a pathway to legalization and green card for immigrant workers by entering into a care job. So we very much think about how we shore up what workers need as a part of a broader strategy to build a robust care system. So I'll stop there.
Thank you so much, Hae-Young. Really appreciate you grounding us in the realities of the paid workforce. So I see some of you have already been putting questions in the Q&A. Please continue to do that and we will get to those shortly. So Jason, I want to turn it back to you because in reality, as you pointed out in your presentation, there's a lot of fluidity between family caregivers and paid care workers. I know from my own experience that caring for an older adult is usually a partnership between a family caregiver and a paid care worker. There are also programs, as you mentioned, that allow family caregivers to be paid through Medicaid, and that type of support for family caregivers is particularly important for people with disabilities. Unfortunately, it is directly threatened right now because of federal and state cuts to Medicaid. So can you tell us what is happening and what advocates and funders on this webinar can do about it?
Yeah, absolutely. So what's happening right now is a really concerted effort to scale back the role that home and community-based services play in making care sustainable for families and communities. We are seeing that on many levels, one through HR1 and budget cuts, nearly $1 trillion of investment in the Medicaid program. We're also going to leave states with really difficult choices to make. And what we've seen is when states have fewer dollars, historically, the first services to get cut are home and community-based services because these are optional services under Medicaid. And so that is puts these really essential, whether that's self-direction, puts those programs on the chopping blocks in states across the country. But what we're seeing is amazing resilience, determination, and mobilization among advocates, family caregivers, care workers, people with disabilities and their family caregivers. We just saw this past week in Ohio, where as part of the fraud, waste, and abuse narrative, self-directed programs in Ohio were put on the chopping block. There was a bill that would have eliminated the ability for family members to receive payment for their essential care services that they provide, which would have taken 7,000 care jobs out of the system in Ohio. And that care, while that payment would go away, those dollars would go away, the need for care wouldn't. In fact, it would get more intense. And so advocates mobilized, pushed back, and so we're able to remove that provision of the bill that was ultimately passed in Ohio, really demonstrating that while it's hard, it's an uphill battle. There are wins to be had even in this environment. And so for funders, I think it is supporting that work, that work of education, mobilization. We were proud to see our research leveraged, our state data leveraged in that work. So there's, I think, an opportunity for funders to come together, whether you're supporting direct mobilization or the research work or the policy work. There's something for everyone right now, as we're worried that will set a precedent, one, in terms of that model of legislation in other states, but then hopefully also that precedent of mobilization and pushing back and ultimately being successful in defending these essential services that families rely on every day.
Thank you, Jason. I think it's really important, as you have, to point out that victories are possible and pushback is working even in these dire times. And I think it's also really important for you to highlight work in the South in political climates that people don't always think you can make progress in. So I'd like to turn to you, Inamai, and then Hayoung, to just wrap us up. So we have about 125 advocates and funders from around the country on the webinar today. What can they do to advance the policies that you both outlined to improve the livelihoods of both family caregivers and care workers? Inamai, you can start.
Sure. So I think one of the biggest things would be to help us increase public and political support for policies that support caregiving. And first, to do that, we can all elevate real stories and make caregiving visible so that it's better understood as an issue that affects everyone. So, one of the biggest barriers is invisibility. People think they're alone, even though millions are experiencing the same thing. And a better balance, we run a free legal helpline where we hear from workers who are trying to balance these needs. We heard, for example, from a truck driver who lost his job when he needed to care for his father. He had nearly 20 years of experience, a spotless safety record, and multiple awards. His father, who was a Korean War veteran, suffered a stroke and his condition worsened over time. When he stepped away to be with his father at the end of life, his employer told him that he would be terminated if he left, but that he could, quote, reapply later. But after his father passed, he tried to return to work, but he was refused rehire. And take another example, a worker who called our helpline Christina. She became a first-time parent the same summer that her mother was diagnosed with stage 4 lung cancer. At the time, the state of Virginia had no paid family and medical leave, and neither she nor her husband had access through work. So they exhausted their savings so she could take unpaid time after childbirth. And then just 10 days after her son was born, she learned her mother likely only had months to live. So her mother entered hospice and passed away when her baby was just 11 weeks old. And so Christina's story reflects the reality of sandwich caregiving. So she's caring for a newborn and an aging parent at the same time without adequate system support. And these are not rare situations. Almost everyone has a story like this, and we can all share our story so that people can better understand that this is a much broader and more systemic issue that affects all of us. The second thing on the same vein is just highlighting caregiving as really central to the the affordability crisis and the economic policy, and that it really can be a political winner, really pointing to Virginia and other states like this as an example.
Thank you, Anamai. And I think some of the states where paid leave is on the cusp is, I think, Pennsylvania and New Mexico. Is that correct? Are there
Yes.
others you'd want to highlight?
I think those are the biggest ones to highlight for right now.
Right,
Yeah.
great. So if you're from those states or funding in those states and not already connected to those programs, please, you can find information. We'd be glad to connect you to the advocates in those states. So, Hey Young, what would you recommend that folks on this call do?
So, as we talked about, in the midst of all the crisis and harm that we may be feeling, there are moments of victory. So, at the nexus of care and immigration, we actually had an incredible, amazing victory at the national level, where on the House side of U.S. Congress, including 10 to 11 Republicans who voted along with the Democrats to extend Haiti TPS protection for the next 3 years, right? And so, and that really is the first bipartisan positive legislation that passed under this administration, when the administration has been so aggressive against pushing out an anti-immigrant agenda. So I think that work is happening, and I think continuing to support that effort. I would really underscore, I think Jason has said this, others have talked about this, is, you know, just the true statement, care is what makes all of the work possible. All of us need more care and not less care, right? I mean, Jason talked about the number of family caregivers, like 10,000 people are turning 65 every day, 10,000 kids are born. We as a country are going to need more care and caregiving, whether that's paid or family caregiver. And I think really thinking about supporting a comprehensive care policies that is not a piecemeal, because I think we want to build in choice and agency for people, right? Some people may want to be a family caregiver and give that care, right? And others may not want to do that and go work in the labor force. So I think trying to really think about and support efforts where we build an agency flexibility and just more meaningful care policies that allows people to have access, quality, right? And I think at the end of the day, I hear this a lot from our workers. Again, going back to what Trump administration did when they started the process of yanking federal minimum wage rights for home care workers, our workers were pissed. Sorry to say that word. They felt so disrespected because they love their work. They take so much pride in their work, right? And the fact that that action was taken, but they still go to work every day, right? And so really supporting and making sure that there is dignity both on those who are accessing care as well as those who provide care.
Thank you, Hey Young. Well, we are getting some really meaty questions in the Q&A. So I'm going to start with a big one. And Hey Young, you probably want to be the first to answer this, but others feel free to answer as well. So we have a question about what are your recommendations and predictions on immigration reform?
We are extremely helpful. As I said, we have our own affirmative agenda called Care for America, which is to create a pathway to green card and citizenship for workers with prior caregiving experience to enter into either direct care job or childcare job. Uh, and as I said, we call our campaign Care for America. I think that we still have to get through this administration. I would say two things. We have to build now and we have to start now, and we have to build the largest movement that allows us to win, but allow workers, immigrants who may be qualified to reap the benefits of that positive policy change to actually apply and get on a path. What we've heard from our workers is that there's enormous amount of fear people are experiencing, rightly so. And I've been really sitting with, we need durable solutions. We need a legislative fix. There's no ends buts about it, right? I love administrative policy change as much as anyone else, but what I'm hearing from our members is that they need durable solutions. And that is the path we're getting on. We're also very clear-eyed that that road to victory is going to be challenging, right? But I would say at the work that we are very proudly doing at the intersection and nexus of care and immigration, people need care. People need caregiving, right? I mean, Jason shared a number of data, but I will throw in another number. By 2034, that's just 6 years from now, we're going to need to fill at least 9.7 million direct care jobs. That's on top of what the number of family caregivers that will grow, right? And so we are clear-eyed. This is going to be a huge fight, lots of challenges, but we're ready to take that on. And so it's a long way to say, I think we are really thinking about a post 28, 29 path, but we need to build now and start now.
Great. Jason, Inamai, anything to add on this question?
No, I would just say I'm really appreciative of the amazing work that Hey Young and everyone at the National Domestic Workers Alliance is leading, and to remind folks that this is a generational issue, right? Like care is a fundamental part of the human experience. Like we're always going to be tending to care needs. And so everything we do now is planting a seed for us to harvest later, right? And so the fact that it's hard now, that there might not be a window now, shouldn't deter us from doing that essential work now, because as Young mentioned, like the need for care is only growing and it's growing exponentially. And so this is something that we're going to need to solve over generations, and not just a 2-year and 4-year window.
Mm-hmm. Mm-hmm. Yep. All right, let me get into another question. It's a bit of a long one. So the question is from a union negotiator for low-wage long-term caregivers. And this person is curious to hear, what role do shorter work weeks for all with no loss in pay benefits have in the fight for caregivers? In other words, a 4-day, 32-hour work week that allows people to address discrete events. That allows people to address the more regular events, not just the discrete caregiving events that they can address through paid leave. So Inamai, maybe you want to take this one first, and then we'll see if Jason and Hayang have anything to add.
Yes, we have been pushing for policies that broadly include like fair and flexible scheduling, adjusted schedules, remote work, all of that, and including a 4-day work week, are all things that I think would help caregivers. Anything that is offering some kind of flexibility. Yeah, definitely.
Right. Thank you. Jason?
Yeah, I think this is an important issue and an opportunity for, one for mobilization and work on federal policy, but also an opportunity for employers to innovate and think differently. What we see in our data is we're at a high watermark when it comes to employers offering benefits to support family caregivers, flexibility being one. And as we've talked about, the need for care is only growing, and more employers are starting to feel that pain point amongst employees and are thinking about and innovating and introducing new benefits. And I think we need employers to think beyond just the employee assistance program and think more fundamentally about things to change and root a culture of care, and things like these more innovative approaches to work weeks and hours are ripe for that kind of thinking.
Great, thank you. And hey, Young, I mean, this applies to paid care workers as well. You talked about overtime pay, flexible schedules, all of that. They are workers as well who have caregiving responsibilities.
Yeah, I mean, I think obviously if, people can support them, if they're earning, good wages and are able to support themselves on a 32-hour week, that would be awesome. I think what we see in terms of home care workers in particular is that, they have a set of clients or patients they see in their homes, like, so they're like moving from one patient to another. And it's really a question of like funding. Like, is there enough money to pay workers high wages so they could work less hours? I think our workers would love that.
Thank you. So there are a couple of questions that you all answered already in the Q&A, but since not everybody might see those, and I think a few of them are of general interest, I'm just going to highlight some of those now. So first, for you, Jason. So the 63 million family caregivers that you mentioned. The first question is, does this include parents of children with special needs? And the second question is, what would the total number be if we included all parents who are caring for children?
Yeah, absolutely. So the 63 million is a number that includes family caregivers of adults with a complex medical need or disability alongside caregivers of children with a complex need or disability. When we look at care across the lifespan and look at that ongoing complex care alongside parents and caregivers of children, that number rises to over 130 million Americans engaged in some form of care. That's around 1 in 3 Americans engage in some form of care across the lifespan and across intensity level. I think that's the other important. Our 63 million is really high intensity care. But care is a continuum. High intensity care today is going to look something different in a month or a year from now. And so that, this is why it's so hard to measure care, but so important as we think about the need for policy change.
Absolutely. And again, from my own experience, we're all one fall away from lower intensity care becoming high
Absolutely.
intensity care, right?
Absolutely.
So another question in the Q&A that you addressed, but maybe you could share with the whole group, Inamai, is a little bit more about how Georgia is addressing issues regarding caregivers.
Yeah, so Georgia first passed 3 weeks of parental leave for state employees in 2021. And then a few years later in 2024, they doubled that to 6 weeks and added in teachers. And then this year, they added 3 additional weeks for childbirth recovery. So each of these small wins is allowing the issue to be like repeatedly in the center of attention and repeatedly talked about. And so each one of these wins helps build momentum towards much broader paid leave. And so that's, eventually what we're trying to move towards.
Great, great. And I also see a note in the chat about the home care cooperative model that the Filipino Worker Center is doing in California. And we're also seeing that in some other parts of the country. So, hey, Young, do you want to say a word or two about that before we wrap?
Yeah, I mean, I think the Filipino Worker Center, which is one of our affiliates in California, has been really leading the way and thinking about this. And so it really is, I think there's both amazing things and there's some real challenges of that, because sometimes the co-op may not be sustainable if you are largely in a public funded scheme, which means like you're getting Medicaid dollars, like reimbursement rates, to provide care and pay workers, because just the limit is funding. So I think the co-op seems to be more successful if we're in the private pay, right? And there's plenty, including Filipino Worker Centers, really thinking about that. I do think it's a really important model, right? But again, all to say, again, it only goes to show that we need more care and we need more care workers and people need more care, right? And however that is delivered, whether it's a co-op context or as an agency context or as like what we call the consumer directed, where it's like directly to individuals, we need all of these options.
Great, thank you. So we have a few minutes left and no more questions have come in. So first I want to turn to the three of you to see if there is anything else that you would like to share with this group that you weren't able to cover so far in the webinar.
No, I would just say stay hopeful, right? This is a really hard issue, and this is an issue that's hard personally for so many of us. It's also an issue that's hard from a policy perspective, but it's also an issue that wins, right? As Inamai demonstrated, as we've seen in Washington State, we've seen in over 10 states with caregiver tax credits. You know, this is an issue that when it's on the ballot, it wins. And so we just got to keep pushing that boulder up the mountain, and eventually we're going to get there, and then we'll have new battles to fight, right? Because we're going to be tending to care as long as we're in community and loving one another, but progress is possible.
Yeah, I would just second all of that. And then just add, so we have a free legal helpline. So if there's any constituencies that you have that are grappling with these kind of questions, please send them our way. There's my colleague just dropped a link to our helpline in the chat. And then if there are any like state campaigns that you have more questions about or want to get involved in on paid leave, please, definitely contact us, and we're happy to put you in touch with our partners on the ground.
I would add that, to make care affordable and accessible for everyone, it is going to be expensive. There's an important role for the government to play, and I think we have to all work together to make sure that our government delivers, right? And that we have to like build that political will for people to have affordable and accessible care and the workers to have dignity jobs.
Well, thank you, Young, for voicing the theory of change of the Care Fund as we close out this webinar. This has been a really rich discussion. I so appreciate you highlighting the need for hope and pointing to the real victories that we've had, especially at the state and local levels, and even in very challenging political context, and Young, for raising the need for revenue. As many of you who have been following the Care Fund know, we've had other webinars that focus on tax policy and revenue. So that is essential for everyone who is interested in care. We have to look at public investment, and we have to look at actually raising more tax revenue in order to fund the care we need. So with that, I want to again thank the John A. Hartford Foundation for co-sponsoring, co-hosting this webinar. I want to also thank our co-sponsors, Grantmakers in Health, Economic Opportunity Funders, and Grantmakers in Aging, and especially give a huge round of applause and thank you to Young, Jason, and Inamai, not only for sharing your time and insights with us today, but for all the work that you do and will continue to do. Thank you so much, and thank you all for participating.
Thank you for
you.
convening this conversation. Take care.
Absolutely.
Thank you. Bye, everyone.